So let's say a patient comes in and they are 500 pounds. A lot of those 500 pounds are in the abdominal wall of that patient. So as a laparoscopic surgery, you're physically having to move that abdominal wall. Well, luckily enough with robotic surgery, I'm on that separate console so that the robot is what's fighting the abdominal wall. So when I'm doing the surgery, I don't feel that at all.
Hi friends, welcome to the Aspire and Acquire podcast. I'm your host Sandeep Suri. Join me for listening to some incredible stories about some of the best professionals from very diverse fields like combat flying, robotic surgery, dancing, tea farming, journalism, deep sea diving, and so on. These accomplished professionals are not just outstanding in their jobs, but also have unique stories to share with us. We have tried to make the show truly global by having these guests from different parts of the world. So without further ado, let's dive into the session. Robotic surgery has come a long way since it was first introduced in the 1980s. The first robotic surgery system was developed by the Stanford Research Institute in the 1990s. Today, robotic surgery is used in a variety of procedures. The benefits of robotic surgery include less pain and scarring, shorter hospital stays, and faster recovery times. Additionally, it allows for greater precision and control, reducing the risk of complications during surgery. On the other hand, if one has to look at the future of robotic surgery, it is likely that it will become even more advanced and widespread. Researchers are currently exploring the use of artificial intelligence and machine learning to improve the accuracy and efficiency in the field of robotic surgery. However, there are also challenges associated with robotic surgery. One of the major challenges is the high cost of robotic surgery systems, which can limit access to this technology for some patients. Overall, the history and future of robotic surgery are characterized by rapid development and innovation, but also if you flip the coin, there are ongoing challenges and opportunities for improvement associated with robotic surgery. Our guest in today's show is Dr. Amit Taggar, a renowned bariatric surgeon in the US. Dr. Amit, as a child, excelled in the game of tennis. At the age 14, he was ranked 12 in the US, and by 16, he was 256 as a junior in the world. This allowed him to earn a Division I scholarship at Georgia Tech. Although he did not become a professional tennis player, but this discipline and belief helped him become a surgeon and excel in the field. After starting his professional life as a bariatric surgeon, he soon became a leader in this field. Currently, Dr. Amit is number one case observation for robotic bariatric in the US. Usually, every day he operates, he has a surgeon from the country and from around the world come to observe him operate. So let's dive into the session and hear from Dr. Amit himself about his journey of success and the future of robotic surgery. Hi, Dr. Amit. Welcome to the Aspire and Acquire podcast. It's a pleasure to have you with us.
Well, thank you for having me. I'm very humbled and honored to be here and look forward to the talk.
Let's start the show with your journey from being a tennis player to a surgeon.
I think that being a tennis player had a lot to do with me becoming a relatively successful surgeon, and it goes back kind of quite some time. I was lucky enough, and I'll start with my mom and dad, as most of us do. As becoming a tennis player. I have no background. My parents have no background in tennis, but they played in our local neighborhood tennis. And obviously, as a young kid, I probably was 7 or 8 years old. I got on the court with my mom and dad, and I was pretty good at, without taking any lessons or anything like that. Played a small tournament in Augusta, Georgia, a local tournament. I actually won that tournament. And I had some coaches kind of see me at that time and saw I had a little bit of talent. Lucky enough, once again, my parents allowed me and gave me, which is, not very often you have Indian parents see their kids thrive in athletics and really give them all the resources possible. But my mom and dad saw that I had some talent. Other coaches told them, I could be pretty good. And they allowed me to really have my journey in tennis. Lucky enough, by 12 years old, top 10 in the state, number one in the state and number one in the South. I realized, maybe at the place I was at the time, a small city, I was kind of outgrowing the with my tennis skills. So my parents, took me down to Florida. My mom take me down, went back to school. She was a nurse by trade, went back to nursing schools to help me provide for tennis and help me become a better, help me be able to get the best training. And by the time I was 16, I was ranked 256 in the world. Had a couple knee surgeries, went to Georgia Tech where I had a tennis scholarship, played tennis there. But after my knee surgeries, realized pretty early on, tennis was not going to be my ticket for the rest of my life to provide for my family. Decided at that point, I need to figure out, what my next step in life is. As I said, my mom was a nurse, and she's always been somebody that, showed me the way of medicine. And then my brother-in-law, my sister married my brother-in-law, and me and my sister have always been very, very close. Somebody that I've always aspired to be like, even to this day. To the day, it's kind of hard to say my brother-in-law's best friend. My friend, I met him at 17 years old. But he was also a doctor. He's a cardiologist now, and I want to say he was a resident or a fellow at the time. But he's always been a huge inspiration to me, and realized early on that's what I wanted to be like. I wanted to be a doctor. Having my mother as a nurse and my brother-in-law being somebody I want to be like, and being such a successful, smart, and a very well-rounded doctor, which I saw myself as and wanted to emulate. Realized early on that that's what I wanted to do, and then took course to become a doctor, and worked very hard, but really used my tennis mentality, of being a doctor, and be not just a doctor, but trying to be the best doctor that I could be.
Very interesting. So first thing first, what is bariatric?
The bariatric surgery is what people would call weight loss surgery, but it's a lot more than that. It's a metabolic surgery. We rearrange certain, organs such as your stomach or small intestines in order to lose weight, and not just lose weight, but bariatric surgery is, if you look at a lot of different medical issues that patients have, let's say, diabetes, hypertension, hyperlipidemia, really sleep apnea, the medical issues, get rid of or improve most medical issues. For instance, 80% of diabetics that are obese are off their diabetic medications by the time they leave the hospital. So, as we all know, obesity is one of the leading causes of death, leading cause of most medical problems we can think of. And what bariatric surgery does is not only alleviate weight loss or alleviate weight gain and obesity, currently if patients become more healthy, which long term also improve their mortality. Obviously,
Can you explain how robotic surgery is used in bariatric surgery? That'll be interesting to know, because that's a new phenomenon we are seeing in medicine, right? So bringing robotic surgery into the mainstream.
robotic surgery is something that I was actually a big I was very against robotic surgery for a very long period of time. And the reason why I was lucky enough once again to be trained by a surgeon named Kelvin Higa, who was the best bariatric surgeon in the world. And he was a laparoscopic surgery. So what laparoscopic, robotic surgery, and these surgeries are basically doing surgery with small incisions. When we talk about scopic surgery, laparoscopy is me manually putting small instruments into your body and manipulating your body with my arms directly. When we talk about robotic surgery, what robotic surgery is basically having small incisions, same way as laparoscopic surgery, but instead of me manually putting in and manipulating these instruments, the robot puts in the instruments, and I'm on a separate console controlling those arms. So what's the benefits? What's the negatives? What is all about robotic surgery? Because if we look at, let's say, gynecology, especially in America, the vast majority of hysterectomies are now almost standard of care to do robotically, as well as urological procedures as well, as well as a lot of general surgery operations. So the benefit for us for robotic surgery, at least in my opinion, and what I kind of talk about, is robotic surgery allows surgeons to be very, to me, reduces variables, right? So we all know when we do surgery and we're doing, let's say, obese patients, which are bigger, obviously, if you think about just in general, if you manually are doing surgery and you have patients that are bigger, you obviously have to, use more physical, there's more physicality to the operation, meaning that sometimes patients' abdominal walls are very thick. Sometimes they have a lot of intra-abdominal fats. So there's that variable of patient that can make your surgery different from patient to patient.
Mhm.
With robotic surgery, the variable is minimized because that variable is taken care of with the robot. So let's say a patient comes in and they are 500 pounds. A lot of those 500 pounds are in the abdominal wall of that patient. So as a laparoscopic surgery, you're physically having to move that abdominal wall. Well, luckily enough with robotic surgery, I'm on that separate console so that the robot is what's fighting the abdominal wall. So when I'm doing the surgery, I don't feel that at all. I'm just doing this operation the same way I did a patient that was 200 pounds, the patient before. So in my opinion, robotic surgery has really changed the game, is that it's reduced the variability of surgery, which therefore makes surgery a lot more consistent from patient to patient, which reduces, in my opinion, the chance for complications.
But is it considered as hands-on as a laparoscopic surgery?
It is, I tell patients, you wouldn't know whether I did it robotically or laparoscopically when it comes to your outcomes, meaning that the incisions are the same, small amount of incisions. The only difference is that instead of being at the patients with my arms, holding the instruments, I'm 6 feet away on a console controlling a robot that is doing the manipulation side of the patient. So worst comes to worst, let's say there is a complication. Well, if there's any issues that happen, I get up and I walk 5 feet away and I do the operation, whether it needs to be laparoscopically or open. In my career so far, I've never had that issue before. Every operation I've started robotically, I've been able to finish robotically.
Interesting. Okay. So let's talk about the risks or limitations associated with robotic surgery.
Yeah. So, risks are just like risks with any operation, right? I mean, obviously, we work with bariatric patients, which are patients that have obesity, which, if we all know, obesity, can cause numerous amount of medical issues, whether that's diabetes, hypertension, hyperlipidemia, like we talked about. So the innate risk of doing patients that have those medical issues are there. Lucky enough for us, this is elective operations. So typically for patients with significant medical problems, we can get preoperative clearances, whether that being a cardiac clearance, a pulmonology clearance, a medical clearance. So those risks are minimized. But there's always risk with any operation. You can get your
Sure.
gallbladder surgery, you can get, colon surgery. There's always those risks there. And those are similar to bariatric surgery. A leak or opening up the connections, that risk is much lower than 0.1% in our hands.
Mm.
Bleeding, infection, damage nearby structures. And like I said, with robotic surgery, that risk is the same. But in my opinion, the reduced variability of surgery from patient to patient helps minimize that risk for the surgeon and the patient, obviously. And I think that's one important thing. We have to all realize that with bariatric surgery, there's not room for error. It's not like a patient is having a heart attack, which if they, somebody has a heart attack, the expectation is that they're going to have some long-term injury. Our patients are coming in electively. So even one complication a year is one too many. So, that is really important to have every operation be exactly the same and minimize any complication you possibly have, because you have patients coming in, although they might be sick and have medical issues, they're coming in electively to you do an operation to them.
Yeah, yeah. So how does the use of robotics impact patient recovery time?
And the great thing about robotics is that there's data out there. Whether it's true or not, it's hard to say because I think right now it's really it's a turning point in surgery, right? For bariatric surgery in particular. So for the longest time, until about now, a lot of robotic surgeons, let's say robotic surgeons, were surgeons that really use the robot to do operations they might not have been able to do laparoscopically, meaning that there's a necessity for the robot for them to do the same operation. I think the one reason that I became relatively, I have a great talk track, let's say robotically, is that I was really well trained laparoscopically, and I can do operations laparoscopically just like I could do robotically. So for me, I could do the same operation whether it's laparoscopic or robotic, and I've chosen to do robotics. And I think when you choose to do robotics, it's very different than a necessity. So my choice to do robotics has to do with, not major complications, but my choice to do robotics, like we talked about, is reducing variability for patient to patient. And I think for me, that's a huge deal because although I could be very efficient doing let's say, a hand-sewn gastric bypass laparoscopically, well, if a patient's very difficult and I physically have difficulty doing that patient, then I might lose sleep at night. I might have a complication of a bleed or something that I cannot control. The patient might be there for an extra couple of days for issues I can't control. Robotically, I don't have to worry about that. So post-operatively, in my opinion, patients could have, they could possibly have less post-operative issues. From my data, when I looked at it, laparoscopy and robotically, my 30-day readmission rate was slightly lower robotically.
Mm-hmm.
There's a lot of technological advances with the stapler. Stapling is a very instrumental tool for bariatric surgery. And what the robotic stapler is, it's a very smart stapler. As it, just like your iPhone, it takes a lot of data in, processes the data, and comes back out.
Mm-hmm.
So I have a little bit less bleeding than I did laparoscopically. And those are the most major issues and major improvements that I do have post-operatively. Do I have a little bit less pain? Sure. But really, to me, if it was my mother and my father and my sister, my wife having surgery, I'd really want the modality that the surgeon feels the most consistent at case to case to case. And to me, that's robotics. And that will only continue to get more advanced as time goes by.
Yeah, and that infuses a lot of confidence into people who are listening to this podcast. Yeah. Okay.
Yeah. Yeah.
Um, so, what type of training is required for surgeons to perform robotic bariatric surgery?
Yeah, so it's changing, right? Like I said, this is kind of a tipping point. And at this age right now, this year, bariatric surgery in America, which is different from the rest of the world, 1 in every 3 operations are being done robotically. So, when I did my training, I did, residency. I did my medical school for 4 years. I did 5 years of residency. And then I did 1 year of fellowship in bariatric surgery. I did very little robotics. I did zero robotics in my fellowship.
Mm-hmm.
So for me, my training for robotics was done hands-on, meaning that I did a lab, I trained, and then I had to figure out myself how I want to do robotics. And for me, my goal was to do my robotics exactly the same technical way I did laparoscopic surgery, and basically take my advanced laparoscopic skills and put on the robot. But now, as robotics becomes more and more prevalent in surgery, the current residents are all being trained in robotics. The current fellows are looking for robotic fellowships. My fellowship, which is the best fellowship I want to say in the world, they are now getting a robot there because of because of these issues, because they want to make sure that they can have attract fellows that both want laparoscopic and robotic experiences. So I think that paradigm of how you get trained in robotics or even surgery is changing because robotics is becoming more and more prevalent. And the one thing to know, and I know I'm kind of rambling on and on about this, but there's a lot of talk about, is that right now there's one company that has robotics, which is Intuitive Surgical. The two other really big companies in surgical device sales is J&J and Medtronic. And they both are now coming out with their own robots. So this is pre-competition. You could imagine in 3 or 4 years when there's competition to robotics, the significant technological advances that will happen. And let's say 5 or 6 years from now, I'm pretty confident that every surgical OR will have a robot there instead of having a laparoscopic tower because it's becoming just more and more prevalent.
Yeah, and I guess it's good for surgeons, good for medicine, and good for the patients, right?
100%.
Yeah.
Yeah, I mean, absolutely. I mean, if you can have, anytime there's technological advances, right? I mean, think about, let's say, our old mobile phones. They made phone calls, right? You can make an old back in the early 2000s. they made phone calls. You could talk to somebody, but look at the difference between having a mobile phone now and having an iPhone and all the things it's able to do, right? Well, you can not only just make phones, you can do so many other things. Well, that's the difference between what's happening around with laparoscopic surgery, which is basically that normal mobile phone. You could do the operation, you can be safe and do the operation. But now with the technological advances of having a robot, it can maybe, right now you can have the smart technology for staplers. Well, who knows, 3 or 4 years from now, you might be able to map out the anatomy of a patient to know where there's significant, blood vessels or, other things that make it even safer, right? Like I said, this is pre-competition. So, when you look at what's going on now versus what's going to happen 3 to 5 years from now, it's really exciting because I feel like the technological advances for robotics has just begun.
Yeah, yeah. And it's a journey, I guess. It'll take some time, but it'll continue to evolve over a period of time.
Absolutely.
Yeah. So is robotic surgery available for all types of bariatric procedures, or there are limitations to its use?
Yeah, no, I mean, I do robotic surgeries for every operation I do it now. So, in America, there's a lot of robots available. For instance, our OR, we have a lot of robots here, but we have 10 robots, 10 ORs and 5 robots. So every day I operate, I have 2 robotic rooms that I switch with. So we do, so every case I do now, so the last 2 years, since April of 2021, every operation I've done has been robotic. So it's available for any bariatric operation you like to do. For us, that's all I use as a robot at this point in time. Can I do it laparoscopically? Of course, I can do it that way, but I've chosen to do it robotically because in my eyes, it just makes more sense, and it's the wave of the future. And lucky enough for me, I'm the busiest case observation bariatric robotic in the country, and I want to say of the world. I can't 100% say that, but I've had surgeons from Egypt, India, come to watch me operate, because I think people are understanding that this is where the future is going. And if you can do it efficiently and you can do it safely, I think that's where most surgeons want to be, and they can see what's happening, worldwide, not just in this country.
Can you describe a specific case where robotic surgery was used in a bariatric procedure and the outcome was particularly successful?
Yeah, no, I could talk about surgery today, yesterday. Today I did a patient that I did a sleeve gastrectomy on 2 years ago. She had a BMI of 75, and then came back, uh, did great, had a 20 BMI point loss, but still had a BMI of 55. And I
Hmm.
did a duodenal switch on this patient. And that's a different operation, one that you bypass a lot of small bowel, but can be a difficult operation laparoscopically. Did this. I had a surgeon from Salt Lake City and his entire team down to watch me do it. A 55-minute operation. That patient did great. Yesterday, I did an operation of a patient that was 450 pounds. He was 6'5", and he had a gastric bypass done, had a BMI about 54. And once again, an operation that would have been extremely difficult laparoscopically just from the patient's body habitus, right? Being a long torsoed patient with a lot of, intra-abdominal and extra-abdominal fat. And that operation was done just like I did the operation before. It was very consistent. These patients all have done great. And we'll do great, not just now, a year from now, 5 years, and 10 years from now.
That's fantastic. Yeah. So, what advice do you have for someone considering bariatric surgery as a weight loss option?
I think bariatric surgery has kind of a long history. It's been around for 50 years, 60 years, 70 years. And anything that's been around that long has this iterations of things that have happened to it that have been negative. A lot of times, let's say in the 90s, operations were being done with big incisions. Surgeons might not have been the most well-trained surgeons doing these operations, and there were complications. If you look at now, and you look at the data, getting a bariatric surgery is safer than getting your gallbladder taken out. We've gotten so safe in these operations. And then let's look at obesity. Obesity has, if you look at the data about obesity, if you're morbidly obese, you have a 50 times higher chance of having diabetes. 50 times higher having hypertension, and so on and so forth. And you look at the data, there's so many studies out there, whether it's about fatty liver, whether it's hypertension, hyperlipidemia, that has shown that bariatric surgery not just improves the symptoms. Let's say you're diabetic, you take insulin. What does insulin do? Does insulin ever get rid of your diabetes? No. It's controlling that symptom of diabetes by keeping your blood sugars lower. You'll always be diabetic. You'll always be taking insulin. What bariatric surgery does is get rid of that medical issue. So let's say you're a patient that is a BMI of 45 with hypertension, especially in India. In Indians in general, we have a pretty high preponderance of diabetes. And let's say you're morbidly obese and you're taking insulin. The data has shown 80%, like I talked about before, of diabetics that bariatric surgeons get off their diabetic medication by the time they leave the hospital. The risk of surgery, like I said, is so low of significant complications. It's like telling somebody, hey, you have a colon cancer. There's risk for colectomies, right? There's a risk of getting a colectomy and having significant complications. But nobody would be saying, you know what, because of those complications, I'm not going to get this colon cancer removed, right? Everybody would say, let's get rid of my colon cancer despite the complication risk. What's the difference between that and being morbidly obese? Really none. Even cancer, especially for women, it's 100 times more likely to have cancer for morbidly obese women than it's for normal weight women. So when you look at the actual preponderance of medical issues, mortality, morbidity, and not even talk about quality of life for patients that are morbidly obese, having surgery is the only way that's been shown with data to get you back to where you want to be and live a normal life, and most importantly, get healthy.
Yeah, as you rightly put it across, more importantly, get healthy. That's the key here. Yeah, one last question, Dr. Amit. What do you see as the future of robotic bariatric surgery and its role in the field of bariatrics?
I see a lot of amazing surgeons. I see a lot of amazing technological advances. I always make fun and joke around, you're going to clap twice and the surgery will be done one day, right? I always talk about these kinds of things, but, I don't think that will be done. But I can see a world where you look into a console and you see the patient's entire anatomy and you can map it out prior to surgery and be able to just do basically what you have mapped out prior to surgery. I just see a lot of technological advances that make surgery safer. At the end of the day, we all have anxiety and nervousness about surgery. I tell all my patients, if you're not nervous before surgery, there's something wrong with you. And what I could see with bariatric surgery and robotics and surgery in general with robotics is that we're getting AI involved. We're getting so many things that we don't even know what's possible. You bring very smart engineers into the world and you bring technology into this world and you bring money into this world, and you put these all together for healthcare. And I am really interested in on the crust of my chair to see what the cutting edge is going to be in the next 5 years, because I have a feeling it's going to be pretty amazing.
Yeah, no doubt. Thanks, Dr. Amit, for joining us in this interesting conversation today. I don't think the day is really far away when robotic surgery would become a very common phenomena in medicine. And I'm sure, this space needs to be watched and monitored very closely in the years to come. And all the very best. And thank you so much for joining us.
Thank you for having me once again. I'm very humbled and honored to be here. And hopefully this was helpful. And hopefully patients out there will be a little bit less scared of surgery.
Thank you. Thanks so much. We are introducing you to a virtual library this time in our bonus pick section. It's called Open Library, a digital library to borrow and read millions of ebooks for free. If you're looking for a particular book, just enter its name in the search bar. Or you can click on random ebooks to preview and borrow them for free. The cool feature is to know how many people have read a particular book, or even better, how many are currently reading a specific book. So why wait? The URL is openlibrary.org. All you need to do is to sign up for an account and browse away.